Alrighty, we're coming to you from San Diego again. This is another physician. He's a retired cardiovascular surgeon from this very hospital, so we have to do a good job because everyone knows who he is and vice versa. You can tell he's got some significant degenerative disc disease with degenerative scoliosis, asymmetric disc collapse. He's got back pain, neurogenic claudication, and severe left-sided leg pain, loss of lumbar lordosis. He's got a flat back. On flex and extension views, he doesn't have instability, but you can just see how much his L5-S1 gaps open and develops a vacuum sign. Same thing with 4-5. 3-4 and 2-3 are arthritic, but they don't move nearly as much as 4-5 and 5-1. And on the MRI, you can see he's got a facet cyst on the left side. He's had a previous hemilaminectomy and did well for a temporary period of time where he was walking a mile or two, and then slowly developed worsening pain and inability to stand upright, which is postural. So a lot of his leg pain is probably coming from this facet cyst as well as the spondylosis. This is 5-1. Not much stenosis of 5-1, but lots of 5-1 symptoms, which can be explained by looking at the parasagittal images, and you can see his neural foramen at 4-5 and 5-1 are very, very tight, almost non-existent. That's the left side. And this is the right side. Right side's bad too, not nearly as bad as the left side, but on the right side, 4-5 is terrible. But the other levels, they look pretty good despite the degree of degeneration. So we're not going to try to fix the whole curve, we're just going to try to fix the focal part of the curve that causes the most symptoms. We've done a targeted transforaminal epidural steroid injection into these two areas, and they provided marked temporary relief, which is also diagnostic. So we're going to do a focal scoliosis surgery at 4-5 and 5-1. Decompression alone was not enough, so we'll do a reconstruction so that we can realign everything, do a direct decompression, and keep it that way. We'll utilize a minimally invasive T-lift technique, maintaining the integrity of the structures in the midline by going in paramedian. So we're all hoping for a great result, and if all goes according to plan, he'll be able to go home tomorrow. Just getting started, making the perfect incisions. Baby cub. Alrighty, here's the compression. I've used the burr, and now I'm using the rotating shaver. This is the future. Combination of power, navigation, and good old-fashioned elbow grease. But we're now bionic. We mix up all our different capabilities. But still the human element is the primary thing. Just like Star Trek said. Bone graft. Here's an example of a case where a jamsheedy needle insertion percutaneously into S1 will be so challenging. Look at that downslope. It's going to just drive you into the canal. Another plug for the nav pedicle screw technique using the 5mm burr. Now I can make the perfect entry point and avoid sliding into the canal. Some challenging anatomy, but really simple when you have 3D navigation. Love it. Mallet. L4-5 it is. I think it was right there. Yep.
So he just wants to use the CT scan, or will it integrate with brain loss?
No, he's just going to do a confirmatory shot at the end. Very good bone. The incision just barely, or is barely big enough to fit these things. It's pretty crazy. But that's the whole basis of minimally invasive surgery. Pretty, pretty. Oh, those look good. You're going to feel so much taller. Can you raise your machine up just a hair?
Yeah.
Save that, and then wag. I want to look at L4 really carefully, so wag one way or the other. Just wag. Wag the other way. I want to see the pedicles better. Sure, that looks fine, but still. Can you just wag north? Just wag. There it goes. I see it now. Save that. That looks really good. Come on out. Surgery's all done. We did it through these two little incisions. It went beautifully, so we're all praying for you and wishing you the best wishes and a speedy and robust recovery. Woohoo! This is L5-S1 doing a posterior ALL release. I've also already fenestrated the ALL with the navigation rotating shaver. Now I've got the really big rotating shaver that's angulated right down the middle, confirmed that the blood vessels have already bifurcated. All right, here's some of my favorite part of the case. I have the interbody spacer in right there. And watch this thing get bigger, like a car jack. What? Look at how beautiful that looks. very carefully tamp this in until it pokes out the front, and then I give it a little wiggle. I do that across this way and a little bit more toward me using the various angles. And then I pass a smooth trowel and do a little rotating to kind of pry this open.